had to react very quickly to the government guidelines when the first lockdown was introduced. One of the hardest things we've had to do is restrict visiting for patients, and we've had to do that to be able to keep everybody safe, keep our colleagues, volunteers, patients and their families as safe as possible.
When people come here and they're in their last days of life, being told that they can't spend that with the people that they love has felt nothing but cruel. If you were dying, then you had, say you were a wife and you had a husband and then you had 2 children, having to see those people pick between one of their children has just been the worst part.
It really struck us very early on when we had to restrict visiting that patients were going to miss that family social contact. So it was around what could we do that was different to be able to enable that connection.
We had telephones and iPads for every room, so we could go in with our PPE on and contact the family, and sometimes it would be a multiple call, so you'd speak to families even in Australia, which was lovely.
The difference that you saw in the patient when they were able to have that communication, when there was letters going between, when they were talking, became more animated on the WhatsApp or on the FaceTime call, and their realisation that they could have a look around the house. They could see, one lady wanted to say that her husband had food in the cupboard, so we were able to do things like that, and that made a difference to them, knowing that their family were seeing what their room was like, seeing what they could see, because some of the patients had come in and the families hadn't even never been to a hospice before. We give them tasks, things to keep them busy when they couldn't have their family, and then things to send home to their family, so we'd do handprints. We'd take the patient's handprints and then we'd cut them out and we'd attach them with ribbon, so we'd send them as a surprise in an envelope home through the post, so when they opened it, it was a hug in an envelope, so they could wrap the ribbon and the hands round the children and they could have a cuddle from nanny or granddad or, you know, mummy, daddy, whoever.
It felt like we'd really made a difference to them, especially if you went into a room and the patient was a little bit fed up or missing their family, and you could have that communication in place and keep them amused and make fun with them, painting or doing whatever they chose to do, and that smile would stay with you.
End-of-life care, I never imagined it could be this rewarding. End-of-life palliative care, it's just something really, really special.
The patients are always priority with everybody here. The staff, we're a wonderful team. Everybody is on the same level when it comes to patient care. It's just like family.